Welcome back to part 2 of this exciting episode. We're diving right back into our fascinating conversation.
That's right. And if you haven't listened to part 1 yet and you want to catch up, we've linked to it in the show notes.
Yes, and don't worry if you prefer to jump in now and catch up later. That's perfectly fine too. Now, let's pick up where we left off and continue on.
Some of these procedures can feel like cost prohibitive to some people. Could you give me like give us rather a ballpark of like if I wanted to focus on just like a tiny lift, you're looking at between this amount and this dollar amount, or if can you give us some concrete examples of what that would be?
A typical breast dog can range anywhere from, I would say, maybe $4,000 to $10,000, and a lot of it has to do with where's the surgeon located, what are they known for,
Yeah.
I mean, how long have they been in practice, that type of thing. So they can command, maybe you live in an area where 4,000 to 5,000 is standard for a breast dog. You're not going to be charging 10. Right?
Yeah.
But if you've kind of gotten the reputation to be that
Yeah,
breast
of
dog
course.
person, then you can command
Yes.
10 plus. Okay. Tummy tucks are more expensive because they're just more surgery.
Yes.
So a lot of it too has to do with how much time is it going to take me to perform your procedure.
Oh, I didn't think about that. Each
Yeah.
one is different, right?
So much
if you
time
think
does it
about
take?
a breast dog,
Yeah.
that's typically an hour.
Okay.
Or less.
Oh, wow.
And then the lifts can add on anywhere from 1 to 4 hours.
Wow.
Depending on what kind of lift you're getting, how much sewing. It's all internal suturing. We do lots of stitches to make those scars as fine as we can,
That's awesome.
So it does have a lot to do with your surgical technique, but then scarring is going to happen anyway. So you still have to manage scars afterwards, tailored to the person, right?
Right.
If they do have a history of keloids, we will discuss that because that's not ideal, right? But sometimes they'll say, okay, well, if that's going to keloid, I don't want to do that, and they will avoid a procedure. Or they might just say, look, I need to get rid of this, and I can accept and we can treat the scarring later.
Okay.
Okay.
But at least they know up front.
Right. That makes
And you were saying tummy tucks. So how much? What's the range there?
So for a tummy tuck, it could range anywhere from, I'm going to say, 4 to 20,000
Oh,
because
wow.
it really
Yeah.
depends. Are
Depends on
you
the
doing
person.
liposuction with it? How much muscle tightening are you performing? How long is the tummy tuck going to take you? Meaning, a tummy tuck on a very petite person is going to take less time than a tummy tuck on someone who's larger. They're
Right.
just taller and bigger and have more
More
tissue.
skin.
Yeah, but this is an investment in your
It is an
quality of
investment.
life.
And also,
that's what this is.
I will say, every single friend of mine that has done it has said it's the best
Oh,
decision they
that's
have
good to
ever
hear.
made
Oh, that's
because
great.
they feel better. They feel like themselves.
Yep.
And, I will say, plastic surgery has gotten less of a stigma now thanks to shows that you are on.
Like
you
Dr.
and Dr.
90210.
Nano,
Yeah.
which is
Social
great.
media, I think.
But do you still find people comparing themselves to like certain reality stars and coming in with things that you feel compromised doing? Is that an ethical thing that you come across? Like too big of a breast augmentation or too big of a BBL or,
Yes.
Okay.
And so if I come across a patient that I feel like I can't ethically deliver what they are wanting, I just tell them I'm not the surgeon for you.
Okay.
Because
That's
that's, the
simple.
I
truth.
love that.
Yeah.
I love your honesty.
Yeah.
And that's the truth because I'm not going to make them happy because I don't
That's not
perform
the
that
root
kind
of
of
the problem.
procedure.
Yeah.
You know what I
yeah.
mean?
Yeah.
Totally.
And unfortunately, they'll go somewhere else and find someone else that will do it. But at least I haven't contributed to an issue or put them in danger by performing a surgery,
Yeah.
knowing that it might not make them ultimately happy or that I can even deliver what they're even asking for, right? If I
Right.
can't do it, I say I can't do it. There's no shame in that. That's, not my area of expertise.
Yes.
So that's how I like to approach it. And they usually say, I like your honesty.
Yeah.
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 There's no judgment, meaning I judge no one. Who am I to judge
Mm-hmm.
anybody's motivation to do anything with their body?
Right.
That's their choice. But if I
Totally.
can't perform that procedure or I haven't been trained on it or I just not that good at it or I know someone who can do a better
Mm-hmm.
job, then, I'll refer them. But I think that's important. Yeah. So it does help set expectations sometimes when they do show photos because you could say, look, you don't have enough fat to transfer to
Oh,
give you,
Yeah.
buttocks that
Like
full.
that. Right. Yeah. That's just not going to
So
happen.
sometimes,
Yeah.
You can just, and I've had patients who even say, okay, then forget that. Let's just focus on such and such, which
Okay.
is great.
Which
you know
is-
what I mean?
yes.
Like, so it can,
much better.
yeah, I
Yeah.
think just having that conversation, that openness, And then if you ultimately know you can't deliver, you just tell them that. And then I think they appreciate that you didn't just try to sell them something,
Exactly.
which no ethical doctor will do.
Yes, that's so true.
Is there anything that we didn't ask you about mommy makeovers or just your expertise that you want to
Well,
share
one
with
of the
us?
advances that I found in my personal practice is tummy tucks are known to be very painful.
Yeah.
And any procedure where you think about it, where you're cutting muscle. So even a C-section, you're cutting that
Oh, I
lower
remember.
rectus muscle.
Mm-hmm.
That's very painful.
Mm-hmm.
So what they did was we have a numbing medication in plastic surgery called Marcaine. And Marcaine it's like going to the dentist. You get injected with it.
I
it
was
numbs
literally
you, yeah.
thinking that, Dr. Q. I'm
But
like,
only
oh,
a
it's like
few
when they-
hours and then it goes away.
Yeah,
So
yeah.
I mean,
Okay.
it feels great right after the procedure, but then
you
you have
don't
to,
feel anything.
but then you got to go home to your baby and your family
Exactly.
and perform and
Mommy
and
duties.
take mommy duties and if you're in pain from a recent surgery, it's horrible, right?
Yeah.
Excruciating.
So
Yeah.
for all my tummy tucks, I make it mandatory that they get this injection called EXPAREL.
Okay.
What is that? So they took the Marcaine and they liposomally encased it to time release over 3 days. So for 72 hours, you're going to have a lot less pain. And I inject it into the
Wait, this is
muscles.
amazing.
I'll inject it into the breast if they have had a breast procedure. I think every OBGYN should be injecting it into their C-section scars.
Seriously.
How
Yeah.
new is this?
Yeah, I was just gonna ask,
I'm
why
like,
weren't we offered this?
I know about that.
It's I'm going to say it's relatively new because I've been using it for several years and it's existed before that.
Before that.
But
Are there
I
any
didn't
side
know about
effects
it.
of it? Like, why aren't people
My
using
next
this?
question.
Yeah.
Look at us.
I mean, come on, we're in sync.
Really, the only
Always.
side effect is you can't put too much Marcaine with it, and it also can't mix with lidocaine. But these aren't things the patient will
Of
know. This
course.
is things the surgeon will know.
Yeah.
But the side effect is you don't hurt so
And
much
that's
for
the
3
thing.
days.
Because that was another question of mine. Is one of my friends who had it and did say it was the best pain, worth it.
Yeah.
But I was by her bedside in the hotel that she goes to, and
It was rough.
It was rough.
Yeah.
I'm not gonna lie.
And I don't
It was rough.
sugarcoat it.
Yeah, no.
Because
Oh,
I
I
don't
appreciate that because
Yeah.
I can't stand it
Exactly.
when a doctor is like,
You'll be
"In a-
fine."
yeah.
And
it'll
I
be
know
okay."
my female patients are warriors.
Yes,
Meaning
we've been
they've
through a lot.
been
Yeah.
through a lot. So sometimes I'll even ask them, "How did you do with your C-section?"
Okay.
That gives me an idea.
Barometer.
Yeah, and a gauge of like where
Right,
their
and
pain
if-
threshold is and all that.
Exactly.
Yeah.
And then I have a lot of women who are very all natural. They'd want to avoid narcotic medication.
Yes.
So then the EXPAREL is great because I've done mommy makeovers where they just took Tylenol after. Now not everybody's gonna be like that. So let's say they do have some pain afterward. I will say it would have been a lot more severe had we not
course.
used the EXPAREL.
So, what else can a patient do to prep for surgery? Like, what are the top 3 things someone should ask in their consultation?
I feel the most important question is to ask if your surgeon is board certified, okay?
Okay.
Board certification in plastic surgery means we've gone through a lot of training, and most of us, or some of us, even do postgraduate fellowships like I did for aesthetic surgery to really hone into a particular area because otherwise it's broad. Like I said, plastic surgeons operate from the scalp to the toes.
Right.
So if you want to hone your cosmetic surgery skills, that may take a little more training or time. Some people know they got great training at their program. But there's board certification for other kind of specialties. I can say OBGYN, dermatology, but they may
Right.
start doing cosmetic surgery.
And not be board
and not be
certified
board
in that.
certified
That's
in
so
plastic
interesting.
surgery.
I had no idea.
Yes.
So you definitely need to.
You want to
find
know
that out.
what their board certification is in.
Okay.
Okay, good
And
to
they should
know.
also know that board certification in cosmetic surgery is also different. But you can have a great surgeon who's a cosmetic surgeon board or a plastic surgeon.
Okay.
So that's important.
Okay.
But you want to make sure that your surgeon is operating in a clean and sterile environment
Absolutely.
Yes.
that has been accredited by the appropriate board, right?
And people just assume that.
And
but
they
you
I would
need
never
to
have
ask those
Yes.
questions.
I never would have known to ask
I
that.
wouldn't even have thought of that. I would
And
just
all you could
assume
say
that,
is,
yeah.
where do you perform your surgery and does it have the proper accreditation? And what is that accreditation? And you can look at
And
it
then you can go
later.
Google it.
Yeah, if
Yeah,
it doesn't pop up
exactly.
as,
Dr. Q, thank you. What else?
Wow.
Is there,
And
was
then
there
that was
a
number
third?
I
Yeah.
would just, I would say, how available are you as my surgeon for problems that may arise after surgery? And that's where sometimes tourism type surgery can get tricky because they go to another country, have the procedure, and then they get shipped off to wherever, whether
my
that's home or and
I never thought of
if
that.
they-
Aftercare.
right,
Yes.
aftercare. So you want to know that your surgeon is available for you or has staff available for you pretty much 24/7 in the beginning.
Yeah.
And then be pretty regular for follow-up.
So you talked about the post-op appointments, which I'm sure people are like, oh, that's so expensive. I'm going to go elsewhere. But it's worth it.
Well,
I
the
mean, why would
post-op
you-
care is at no extra cost.
It's
to the
included
patient.
in the cost
well,
of the
that's good
procedure
to know.
itself.
Yeah.
That's really great.
So you're going to have surgeons who don't see their post-ops very often. You're going to have surgeons who see them more often. It's just
Okay.
a preference
I
per
would
surgeon.
never
Per
have thought
surgeon.
to ask that question, Dr.
know,
Q.
that's
so- good,
Your
I'm glad.
availability. Like, no, that's
Yeah.
That's
like,
huge.
Dr. Q, what
Yes.
are some of the most common misconceptions that you hear during consultations?
One would be that when people think that they can just do all these procedures in one sitting.
Okay. Just fix
get it over with. I
Yeah.
just want to
And
before after.
Magic spot. Yeah, exactly.
and then we have to get into the discussion of how much is safe to do, how
Mm.
many hours, because we like to limit it to no more than 8 hours max in surgery, okay? And
Okay.
that's pushing it.
Okay.
How many hours is it going to take? And sometimes I'll even, depending on their pain tolerances, say, do you really feel you can handle having, a facial something along with a body something?
my
And maybe
gosh.
it's best
can't handle
we split those up and we do what's more of a priority for you first, and then we can address the other things later. So
That
they
makes
just don't
sense.
understand, you have to educate the patient that the more surgical procedures you do at once, and then set a limit as to what can be safely done in their given time period,
Mhm.
and then set expectations for what's the best sequencing. You do
Okay.
A, B, and then C because it makes the most sense for your body type, your recovery, and your lifestyle.
And one other question as far as the follow-up from the procedure, as I mentioned before, my friend was in a hotel. Is that common, or how do people recover
Recovery-wise?
outside of home so they're not lifting children? And so what do you suggest to people?
Oh, that's good. That's good.
So it varies only because, I'm in a certain location. So I may have some patients that their home is very close by and I'm safe with what I've done sending them home.
Okay.
There are some people who don't feel so comfortable with that, so we can sometimes send home some kind of healthcare, whether it's a nurse, and
nurse,
it can different on to different levels,
Sure.
right? Depending on how much care they need.
Okay.
There are some aftercare facilities, but they have to be set up, in your local
Right.
area, that sometimes people will want to go or won't want to go because it's an additional fee for it.
Of course, yeah.
So you have to also know, like, how much surgery you've done. Is it safer to send them to an aftercare facility, or can they go home?
I see.
Now, with that being said, with my practice in Newport Beach as well as Palm Springs area, people fly in.
Yeah.
So you have to accommodate, right? And so it's been actually helpful Airbnbs because I bring it up because they have a kitchen and you don't have, a little more space.
have a nurse
Sure.
there.
You can bring a friend or a family
Yeah.
member to take care of you.
It's homier feeling
Yeah.
in a hotel.
homier.
Absolutely.
So,
Yeah.
so now hotels have kind of become a last resort, right? But still, depending on what they're having done. But
yeah, that makes
but
sense.
you have to accommodate people who are flying out, and we talk about all of that.
That's in the consultation, of course. Yeah,
Because
set it all up.
The one blessing now with post-COVID is we can do a lot of follow-up care once they get past the immediate recovery period via Zoom,
Oh,
via
that's great.
FaceTime, via.
Okay.
So then they can feel like, okay, I can fly in, have my surgery, stay for a few weeks,
Sure.
maybe fly in another time, but then we can follow up, virtually.
Yes.
And they don't have to take a flight or a
Oh,
long
that's
drive.
great. I never thought about
there's
that. That's
options.
great. Yeah.
You talked about the importance of the timing of if you're choosing to have a tummy tuck, that it needs to be after you're finished having children. But what about age? If you're a woman over
good
45, are you still recommending a mommy makeover to those women?
Oh, for sure.
What's
because-
the oldest you can?
That's a tricky question. One interesting statistic is age has not been shown to be a risk factor for like
Okay.
plastic surgery.
Oh.
And I
Oh.
can tell you, being in the Palm Springs area,
Oh,
I
yes.
have operated on some 80-year-olds and plus
Oh, yeah.
Okay.
who are still getting in their gowns and going to galas, and they look 50.
As they
And they
should.
look fabulous.
Good.
When I was a trainer, my clientele was older, senior
Yes.
citizens, and they absolutely got plastic surgery in their 80s and
Yes.
90s, and they looked fabulous, let me tell you.
I just had a recent patient in her 50s and I asked her the question, why are you doing this now? Because I like to ask that question.
Yeah.
And she said, I can finally afford it.
Of course.
There you go.
Which is such an honest,
Yeah.
and she had
Yes.
the time. And guess who helped take care of her? Her daughter. Because her daughter was grown.
Oh my gosh.
And could help take care of her.
Yeah.
And her daughter was very supportive, and they know each other better than anyone else.
course.
Right?
That's
So,
so
even
great.
if someone's timing isn't right because of life happens and
Life is
you
lifing.
got to take care of yourself and your family, then you can defer it to when you are ready to have it. Now, the reason we say be done with having children. The first reason is I will ask a woman, if it's a breast procedure, are you wanting to breastfeed? Because after a breast procedure, I can't promise if you can or cannot.
That you'll even
Right.
be able to, sure.
Okay.
Yeah.
Now, sometimes it's not an issue. They'll say, I couldn't breastfeed my first
Anyway,
child
right.
anyway. So we have that conversation. Now, the reason for the tummy tuck is, imagine, if you will, that I've sewn your abdominal muscles tight from right under your breastbone all the way down to here, around the belly button. You're tight as can
Like a
be.
corset.
Right.
Yeah.
And then you get
Hold it.
pregnant. You
Oh,
don't want to
forget
be
it.
stretching all that. I can tell you it's a concern, and it's a valid concern. So we say you should be done.
Yeah. That
Have
makes
there
sense.
been some women who've gotten pregnant after a tummy tuck?
Really?
Yes. I mean,
mean,
any
yeah.
possible scenario
Yeah.
can happen.
Okay, so this is one of our favorite segments called Ask the Expert, where we gather questions from our audience and, ask the expert.
Great. Let's do it.
So we would love to know, do you recommend anything for patients to be prepared for as far as age, health, previous conditions? What are your recommendations?
That's a really important question. I'm glad you asked it because, okay, so our limitations in surgery will depend mostly on the health of the patient. So if you have a young, healthy patient, that's great. If you have an older, healthy patient, that's also great.
Okay.
If you have a younger patient who has several medical conditions, depending on those medical conditions, you may want to limit how much surgery you do at once, things like that. You have to be safe. And then for all patients over 50, we require, as part of the pre-op process, a medical clearance.
Okay.
So not only are you going to get your pre-op lab testing and your studies, that's typically a chest X-ray, EKG, typical blood work. The other thing too, it's very important to mention that smoking is really detrimental to healing.
Yeah, that makes sense.
And if someone is an active smoker, it may limit what we can do because of the healing of the skin and the scarring, and it puts them at higher risk for infections and other things. So
Smoking's just the
we
worst.
want to make sure that the patient is safe and is going to get through surgery safely
And recover
Okay.
well.
and recover
Yeah.
well.
Absolutely.
So that may limit how many procedures a patient may be able to go through, depending on their health. They have to be healthy enough to
Okay.
undergo everything.
When you say smoking, do you also mean vaping? Because vaping is super trendy right now.
Oh, that's a great question.
That
Yes.
is a great question.
So personally, in my practice, I do a urine nicotine test. So whether you're smoking, inhaling, not inhaling, vaping, I don't. And secondhand smoke, it can turn out positive.
What?
What?
So,
So if you live with a smoker?
I've had patients who are just around it. They don't even actively smoke, but their test came back. So that.
Oh my God.
So what happens
No,
is
that's
the
good to know.
nicotine
It is good to know.
causes vasoconstriction, and so what happens is you're not going to get great blood flow to the tissues for the healing. So that clamping down, it's not even. I mean, of course, we're concerned about the lungs, but it's more about the clamping down of the microvasculature that will inhibit proper wound healing.
But previous amount of surgery is not a factor. Like,
Well, I would just ask, how did you do with all those? Meaning,
okay.
did you tolerate anesthesia well? Did you scar okay? Did you, So those are all just helpful, and it wouldn't
Okay.
preclude
That
you
makes
from having
sense.
something. It would be more your general health.
That makes sense. Okay.
You know what I want to know about? What trends there are.
So the trends I'm seeing, actually, BBL was very big over the past several years.
Okay.
Okay.
but it's actually kind of getting away from that.
Oh.
And a lot of the moms that I'm seeing now are wanting more natural.
I
That makes
love
sense.
that. It does make
Yes.
sense. It does. Yeah.
So even in terms of their breast enhancement, they may not want to go as big or with a lower profile. So I think that's probably the biggest one that I'm happy to see coming back into vogue, is that people just don't want to look overdone.
Yeah.
They don't want to,
wanna
so they
look-
want to look natural. And sometimes they'll even say, I don't want people to run up to me and say, what did you do?
What did
Of
you have
course.
done? Oh my
You
gosh.
don't. It's so true. Thank you so much,
Thank
Dr.
you,
Q.
Dr.
You are
Q.
amazing.
She's a mythbuster. She's a
A
professor.
A trademark maker.
I mean, right here with us.
I mean, come on. It was so informative, so educational. I feel like these are so many things that people want to know. Women especially want to know these things.
You allowed us to be vulnerable, but
Yeah.
to feel super comfortable with just talking about things that moms really want to know about.
Exactly.
Yeah, we're moms.
Yeah.
We
This
want to
was
know.
so much fun. I'm so glad. I hope it was
Will you come
informative.
back? Will
Yes,
you join
will
us
you?
again? Okay,
I
good.
have so many more questions.
I
Personally. Thank you.
My pleasure.
Thank you so much for joining us and being part of our growing community.
Stay tuned for new Care Expert episodes every Wednesday. And don't forget to subscribe on your favorite podcast app and YouTube. Hey there, don't leave yet. Just wanted to say, if you want to hear more about health and wellness, check out these episodes of Care Experts. Also, before you go, make sure you like and subscribe.